Hi, everyone. Welcome back to another one of our live video chats. Today, we're going to be talking with JB Gaskins and Dr. Liz Kohler with Blood Assurance. They're going to take us through sort of the major need for donors right now, as well as the steps that Blood Assurance is taking to make sure people are safe when they come to donate. And as usual, I'm just going to leave the Q&A section open. If you have a question for either one of them, go ahead and type it in there. Um, Otherwise, I'm going to turn it over to them. Welcome, guys.
Well, thank you very much, Jeremy. We appreciate you all having us on and give us this opportunity to get some information out to our business leaders and through the chamber. And hopefully the information that we share is going to help clarify a lot about the COVID-19 and its impact on the blood supply right now. And I'm going to start, and then Dr. Liz will give all the great medical technical stuff, but I'm going to give some of the background. It's feast or famine in blood banking. It's you usually never have enough blood or platelets or plasma when you need it. And we were in that situation prior to March the 3rd. March the 3rd, as everybody might remember, is we had the tornadoes going through Cookeville and Nashville, killing 25 individuals, and of that, 18 of those came out of Cookeville, which we supply the hospital. Blood Assurance supplies the hospital. Immediately, there was a call for blood, and we sent everything that we had on our shelves over to the hospital. There were 7 patients that were actually ended up getting transferred from Cookeville to Erlanger in the trauma center. 3 of those were children, and the blood needs never stop. But as the community normally responds very greatly, we ended up basically 4 days in a row, lines out the door, people donating for their neighbors. That started to build our inventories back up. But the blood that was needed at the time of the tornadoes was the vital element that we needed, because without it being on the shelf, there could have been more loss of life. So the inventory levels started to come up. Then on the heels of the tornadoes, you have COVID-19. And all of a sudden, we started getting reports from around the country of school closings, of business closings. That had a massive impact and a scare to us in the blood banking industry that we canceled. I think I have a total there were 12,000 blood drives canceled nationwide, 355,000 potential blood donors that would have donated on those blood drives. And unfortunately, we took that literally that we were going to be in severe shortages. So with the help of America's Blood Centers of America, the Surgeon General and FDA even had come together to let people know that it was safe for good, healthy people to give blood. So we implemented some things that Dr. Kohler will get into about how we were practicing our social distancing. As a matter of fact, Dr. Kohler and I are practicing our own social distancing right now. We're in the same building, but we're in different offices. We thought it was probably the best way to do this, but the fact of the matter is we still have some protocols that we have to follow through the FDA, but also now under the World Health Organizations and CDC on what we need to do to make sure we take care of the donors and that blood supply that they're donating. As our situation is right now, our blood supply looks pretty good. Matter of fact, nationwide, blood supplies are better than they've been probably in months. I haven't seen this. I've been in blood banking for 40 years. I haven't seen these level of inventories since 9/11 of 2001 or just after 9/11. And it's a testament to what the communities rally behind, and the people who are healthy are coming in to donate. So the blood supplies right now are good, but we still have to have blood coming in, but we don't need the same sense of urgency on the local level. So we are really working hard to organize everybody by appointment. We want to limit the number of blood drives There's really not many blood drives to go to with all the businesses and schools that are closed. So our blood centers are getting the bulk of all the donors that we have coming in. But once we get through this COVID-19 pandemic, what we're hoping will happen is the workforce will start to come back online. We're not making any plans for the return to the schools until the next school year because realistically, we don't expect they're going to go back to school. And from what we're hearing, and then we also believe that there's going to be enough turmoil going on that's one less thing they need to worry about is the blood supply. So what we want to do is we want to work with our local businesses. That's one of the reasons we wanted to reach out to the chamber, to our chamber members, and say, be patient, keep encouraging people to donate blood. We practice a philosophy of right type, right time, right technology. Every donor that we talked before we went live, we talked about the difference in blood types, and everybody brings a unique gift. What we want to do is make sure that we match that gift that the donor has with what the community needs. And to rest assured, Blood Assurance is the only blood supplier to the local hospitals throughout the Tennessee Valley area. The next closest is over to Nashville, and that we supply actually some of the hospitals in Nashville as well. So we are the primary sole supplier of blood and blood products to our community and the hospitals in this community. So we need for our folks to donate, and we need our businesses to support their employees donating blood and platelets based on their gift. So I think I've sort of caught you up to speed on where we at, and you will keep the list. Go to our website, bloodassurance.org, and you'll be able to see updates on where we are with regards to the blood supply and the things that we're doing to safeguard our donors and our employees who have really been working extremely hard as part of that essential infrastructure. So I'll stop there, and I don't know if you want to go questions or go ahead and let Dr. Caller go ahead and let you know what we're doing.
Okay. You want me to jump in there? I can tell you a little bit about what Blood Assurance is doing in response to just to make sure our #1 priority is to keep, of course, our donors safe, our employees safe, and our patients safe. A question we commonly get, because it's been posted on social media that's actually erroneous, is blood donors are being tested for coronavirus. Blood centers don't test for coronavirus because it is not transfusion transmitted. It's only transmitted by respiratory droplets. So that's why if you get tested, it's going to be using a nasal swab. So just to repeat, there's no transmission of respiratory viruses, including coronavirus, through the blood. So the only thing we're really worried about, or we ensure that we're safe in, is making sure you're not going to get an infection passed by a respiratory droplet when you're visiting Blood Assurance donating blood. And so what we do is, of course, first, like JB's saying, we want to do right type, right time, right technology. So we want to only collect certain blood types at certain times. So we're moving to appointment only starting a week from now, April the 3rd. And there's a couple of reasons for that. #1 is, like JB was saying, we want to match the types that the patients need to the type that's being donated, because we want your gift to be used appropriately. So we want everyone to make an appointment starting April 3rd. But the other reason we're doing that is we can control the donor flow on both our buses and in our satellites, because we want to ensure that we don't have too many donors, too much crowding within our facilities. We want to really make sure we do a good job with the social distancing. So first of all, make an appointment. Second of all, we have an app. It's called VA Quick Screen, which you can download, or you could go to our website and use that app to answer all the questions on the day of your donation. So what that means is you can save yourself quite a bit of time by going ahead and answering those questions, and you won't have as much time in our facility. The next thing is, once you do present to donate, we're going to do a screening. We're going to take your temperature. We're going to ask you if you've had a history of coughing or shortness of breath, and anyone that has a yes to those. And we also check if you've been exposed to someone who has COVID-19. We're going to decide, do we want to bring you on into the building, or do we want to invite you to come back a different day? And we do that with our staff members as well, because obviously we don't want to expose any donors to anyone who could possibly be infected. So we do that screening, and as long as you pass that screening, you'll come on in. Then in the waiting area, we've removed a lot of our chairs or adjusted our furniture so everything's 6 feet apart. And you're going to see increased disinfectant procedures where, the waiting room is going to get disinfected. We've removed all the magazines. The refreshment area is going to get disinfected. Then you'll go through your interview process. And again, we've increased our disinfectant procedures with the keyboards, the iPads, the blood pressure cuffs, any sort of high touch surfaces, doorknobs, light switches, those kinds of things. Then you're going to go ahead and donate your blood. And of course, we are going to cleanse the bed after each donation. And then you'll go to the recovery area where we have, just the single wrapped snacks and drinks and that sort of thing. And we've increased our disinfectant procedures there as well. In terms of what we're using, you're going to see our people using gloves and things like that. We actually don't use masks in the blood industry. It's just not indicated for us, so you won't see that. And the other reason for that is that the masks are really indicated for sick patients and people treating those sick patients. So we want to reserve those for our healthcare workers. So those are some of the things that we do to protect your health. Another thing we've gotten a lot of questions on is blood type, because you may have seen in the social media or in the general media that an association between blood type and severity of how the coronavirus affects patients. That was a study that was done in China. And in China, the distribution of the blood types is different from that of the United States or other countries. So I'm not sure that there's credence to that. That needs to be further investigated. And that, I think a lot of people are kind of taking information to the press directly and trying to get it out there quickly. And that was not published in a peer-reviewed journal. So other researchers have not taken a look at that information, and there's no reasoning as to why one blood type would predispose you to having more severity of the coronavirus versus another type. So there's no theory kind of backing that up at this point. So just wanted to let you know about that. And I'm definitely available to answer any questions about safety or about our procedures.
Okay, thank you both. A couple of questions I did want to cover. Who are you accepting to come in for appointments right now? If I'm concerned, if I've got a little bit of a sniffle, or if I've got a fever, what are you recommending for folks before they make an appointment?
Exactly. So, we're going to screen you for your temperature at the door. If you do have a temperature, we're going to say, hey, come back and see us in 3 days. A sniffle, that's fine. It's allergy season. I mean, a lot of people have a little cough or sniffle. So if you say I got a cough or a sniffle, we might say, hey, have you been around someone who's been sick with the coronavirus? If it's yes, we'll probably tell you come back another day. If it's no, come on in. And you probably read congestion is not really something associated with coronavirus. That is something colds, flus, allergies. So if you got the sniffles, we're not really concerned you have coronavirus.
Also, Jeremy, we actually screen all of our employees that come to work every day at every location. We do the same thing to make sure that that they're feeling well. And we ask our employees, if you're not feeling well, do not come to work. If you're in a high risk area, somebody that might have had a transplant or something, we're asking you not to come to work and go home and just don't put yourself in that situation. But we're doing this for our own employees, and if you're not feeling well, we'd rather you not come in and donate.
Okay. What about locations? I know you guys have a big office downtown, but you have centers located throughout the Tennessee Valley, right?
We have all the way Cookeville, Columbia, Tullahoma, Cleveland, 3 locations here. We have 4 locations in North Georgia. So yeah, we cover the gamut for the Tennessee Valley area. We go all the way up to Clarksville now. And in July, we'll have operations set up actually in Nashville, where we'll be supplying all of the HCA hospitals from Bowling Green all the way down to Cartersville, Georgia. So it's going to be all the HCA hospitals that we'll start supplying there in July. We already do 4 of them, but now we'll be supplying more. But in recent months, we've actually sent some pathogen-reduced platelets to hospitals in Nashville, and that's some new technology that to make the blood supply safer that we've been working with, and that's with Vanderbilt. So you know, the need is going to be there, and we want to remind people go to our website. If you want to donate, you can find out where there are blood drives taking place. One of the things I think I should touch on is we're moving as a result of what's happened. I think it's going to sort of change the way we think about how we're going to collect blood in the future. And until we get some clear sailing on this COVID-19, I think what you're going to see is more concierge type blood drives going out there in pockets, set up in small communities with specific donors targeted based on their blood type. And we're going to be doing this. It's called the Gold Program through Blood Centers of America. We're one of the centers that is testing that model right now, and we'll be starting that in April. So we'll go to maybe small communities and maybe do 10 donors over the course of 4 hours, but they're going to be, you know, O negatives, or they're going to be O positive or A negative, or whatever we need at that point. And hopefully that will again ensure that we have what we need when we need it.
Okay. And again, I just want to stress for folks who maybe haven't ever donated before, aren't used to this world. You guys are supplying our local hospitals. So when you donate, that blood is going to help people in the Tennessee Valley.
Yeah, I got to tell you, I was a little bit disturbed. I received a notification of a correspondence that came from American Red Cross in Nashville that's doing blood drives at their chapter here in Chattanooga. They did one last Monday. They're doing another one this Monday. And while it's beneficial and will help patients somewhere, it's not helping the patients here. And it's akin to having a food drive in your local community and somebody coming in with a big semi and taking it to like Washington, D.C. You know, the intent is we need to act locally. And we'll act if there's a need and another blood center and we have the blood, we're going to help because other blood centers have helped us out. And we don't want blood to expire on the shelf. We want the intent of it is to help save lives. So if we're doing that and that blood isn't here, it doesn't benefit the local patients, which we need to do first. We need to make sure that our local supplies are adequate and safe before we can reach out regionally or even nationally to put that blood where it's needed.
That prompts another question. When you donate, how long is that blood good for?
Liz, I'll let you handle the technical ones.
Okay. Well, of course, we can save 3 lives with a unit of blood. The red blood cell part is good for 56 days. So it is very rare that we would expire a unit of red cells. What we do is we ship it to the furthest out hospitals first. And anything that they don't use, we can go back and pick that up like a week later, and then we can kind of shift things around and send it to a hospital that may churn through it a little bit faster. Platelets are a little more interesting. They only have a shelf life of 5 days. So that's why when the holidays approach, we really need platelet donors to come out, because think about Thanksgiving, you know, Thanksgiving Day, we're closed. And then the Friday and Saturday after Thanksgiving, you might be watching football or have family in town, or Black Friday body shopping or whatever. And then, here comes Monday, and that's almost, that's like a 4-day holiday weekend. So that can be a challenge for us. And then plasma is good for a year. So we don't usually have a challenge there. So it's mostly platelets and getting the right type of red blood cells.
Let me clarify. You can donate every 56 days. The red cells are only good for 42 days.
42 days.
So with platelets and with red cells, they will expire before you're eligible to give again. If you can only donate every 56 days and the blood expires in 42 days, that blood's going to expire. And normally, if it's O neg, O pos, A neg, B neg, those are rare types. It is or most widely used. Those won't normally expire. It's the ABs. A lot of times, that's why we want those donors to be giving platelets and plasma, because that's like O negative. That's like universal. So we want them to give their platelets and their plasma. But the same thing with the platelets. You can only donate every week, no more than 24 times a year, and those platelets are expiring in 5 days. So it's a constant battle of trying to make sure that we always have an adequate supply on the shelf.
Okay. Well, I think that'll do it for us. I can tell you right now, this O positive donor is going to make an appointment as soon as possible. I encourage the rest of our audience to do so as well. And why don't you give them that website one more time, JB?
Okay, it's www.bloodassurance.org. That is, and then we have all those Twitter and all that stuff that I'm still learning how to use. But yeah, bloodassurance.org is the best way to reach us, and then the phone number's on there as well.
Okay, excellent. Thank you both for being here so much.
Thank you all very much. Bye.
Bye.